the term proactive a couple times. And so when I think of being proactive, I picture looking at my golden retriever, and she's 2 years old, or she will be in October, and being like, you seem like you don't have any issues. I'm going to pay a chiropractor anyways. Is that what you're talking about? Or are you talking about people who are noticing things earlier and saying, like, we don't want this to get worse. We don't want surgery. We don't want things like that.
Well, there's two sides to that as well. When you think of proactive, you get the completely like, I want to do everything I can for this animal. And even though I'm not noticing any signs or symptoms, I definitely want to add an animal chiropractor to my team. And I have people like that. They're mostly chiropractors' pets. Actually, I treat a couple of chiropractors' pets. And then I get the other side of the equation where they notice behaviorally the pet's not quite right, although they can't put their finger on it. So what's interesting about pets is a common survey they did among pet owners. I think a vet school did this. I can find you the quote to it. Over 80% of pet owners thinks that a pet's not in pain unless they vocalize. So that means screaming or crying or groaning. And that's not true. For animals, actually, we notice a change in behavior. So I have a 11-year-old lab, and he won't play with his toys. He won't jump on the bed. He will, walk sometimes a little bit different. It's small and subtle things he will avoid doing because they cause pain. So this is your person who, yeah, it hurts right here. They're pointing to a specific area versus I'm just not going to lift my shoulder that much because I know it hurts on a subconscious level, but I don't know how to verbalize that. That's what animals do when they're in pain. And sometimes pet owners, when they've been around their animal for a long time, they're like, something's just not right. And he can't tell me what it is, but I'm going to look for someone who can tell me why they're doing that or why they're not quite right. So I get two types of proactive. I get the complete, I call them wellness versus maintenance, right? Where I have these wellness people that absolutely no complaint. I can't find anything wrong with the animal, but they choose to identify and fix those subluxations, if you will, early. And then I also have pet parents with a specific, like, I'm not quite sure what or non-specific complaint. I'm not quite sure, but I know something's not right, but he's not clinical enough for the vet to find anything wrong. So I'm going to introduce someone intermediary before this progresses to a drugs or surgery or something more, intervention wise. I want to choose something proactive instead of reactive when the problem gets worse.